Looking at me. Look at that.
No. I'm going to be honest with y'all because y'all are not getting the message correctly. Y'all are listening to people who have access to resources that 99.99999% of y'all don't have. I see patients all the time. I see families all the time who tried to go holistic after they got that cancer diagnosis. It's not going to work for you 99.999% of the time. Now, if you want to go holistic before you get the diagnosis, or you don't want to go to a normal primary care physician, you want to try that, that's cool. But once you get that diagnosis, it doesn't work. Because you're going to get your little sea moss in the jar and you're eating it. I eat it too, 2 tablespoons a day, don't get me wrong. Your oil of oregano, your black seed oils, your turmeric, I get it, right? I get it. Ginger, I get it. Take it from me. It does not work 99.999% of the time. Even people like Steve Jobs, who have the capital to perform, to get anything they want, it doesn't work for them. It's not going to work for the majority of you. Now, I'm not telling you what to do. I'm just telling you that for a lot of people that we see, it's not necessarily something that I would say is trying to save the person versus a palliative care way to go about it. Again, I'm not telling you what to do. I'm just saying, when people ask me things like this, I tell them, if you choose not to do chemotherapy because you think that your quality of life will be less if it doesn't work, which that's what, we see that a lot. My mom was a person that happened to. She chose not to do chemotherapy because if she had not made it past the first or second treatment, she would have died right after. They say 7 to 14 days tops after, versus not doing it at all. She lived for 7 more months. Now, if that's your situation, you can go and try to be holistic in that situation. But if that's not your situation and you have a high probability of getting better with chemotherapy or radiation, I would almost always suggest trying chemotherapy or radiation. Now, this new medicine and everything that we think is working, it does work for some people. But again, most of you all do not have the capital for consistent hyperbaric chamber treatments. You don't have the capital for organic fruits and vegetables and a chef at your house all the time. It does not work. Now, again, if you need more help with anything, follow me for more information. I got you.